Ladies and gentlemen, it is a great privilege to welcome you to the first panel of NCCM 2025, which will explore cancer control across time and levels, global, regional, and local. All the panelists are well versed not just in global policies in cancer, as well as the determinants of health, but also in implementation through their work in ministries and civil society organizations. We are here not just to listen, but to bear witness to progress and to the power of voices that are moving health systems beyond silos, beyond borders, and beyond bureaucracy towards dignity, justice, and survival. And to lead us through this urgent conversation, we are joined by a man who knows this terrain well. Professor Dr. Elil Renganathan, Professor of Public Health and Policy, Jeffrey Cheah School of Medicine and Health Sciences, Monash University, Malaysia. With over 3 decades of experience at the World Health Organization, Professor Elil has been deeply engaged in the forefront of global health, advising governments, building coalitions, and shaping policy from Geneva to the front lines. His leadership continues to inspire worldwide confidence in the science and strategy that drives public health. Now allow me to introduce, please invite Dr. Prof. Elil to the stage. Now allow me to invite our panel.
Thank you very much. In global health these days, you hear the word manel. So a manel is a panel which is mainly made of men. Yeah. So I'm in a very lucky position because it's a womanal. Yeah. Thank you very much. I've got, really quite powerful women next to me, so I'm going to be behaving myself today. As we have said, we've got this overarching theme of cancer yesterday, today, and tomorrow, talking about how we are looking at it across time, across levels. I think in this discussion, we want to take a look at how the global efforts, how regional work, how what happens at country level comes together, the interconnectedness of those things. So I'm really very pleased that we have people. Honestly, all of you have got experience in all 3 different levels, but I'm going to focus on certain levels when I talk to you, but then maybe we could come together later on that. Let me start with Kristie, and I asked permission to call them by their first names because we know each other and so on. So please don't get upset that it's not very Malaysian. So Kristie, the question I have for you is that this year's World Cancer Day theme, United by Unique, speaks to the power of diversity within solidarity. How do you interpret this theme?
Thank you for the question, and please allow me just to also thank National Cancer Society of Malaysia for the invitation, the opportunity to speak on this panel, and also for the support to many UICC members who are present in this room today. Diversity, solidarity, and the United by Unique theme, which is amazingly also the theme of this Congress, as well as World Cancer Day, which runs from 2025 to 2027 with that theme. For those of you who don't know, World Cancer Day is held on the 4th of February each year, and it's a really powerful opportunity to bring together the cancer community, to highlight efforts around the world, and to make progress. I think the thing I'd really like to bring out, UICC is, I think United by Unique is really core to who we are. We're a global membership organization. We have around 1,150 members in 172 countries and territories around the world. And what's really unique about UICC is that our membership is not kind of one segment or one part of the cancer control community. It really speaks to some of the points that Santari made earlier on the stage. It includes national cancer control programs and ministries of health, some volunteer-led, very, very small patient organizations who are working to raise awareness in their very local communities. It includes academic institutions, national cancer societies. It is a very vast and broad membership, and that in itself is exciting because we each have a unique and important role to play in cancer control, and it's only in working together and having that kind of shared purpose that we will be able to address cancer control. It's really important that we each play our respective parts. And our UICC's mission is to unite and support the cancer community to reduce the global cancer burden, promote greater equity, and ensure that cancer control continues to be in the World Health and Development Agenda. And as you can see, diversity and solidarity is just really mixed up in all of that. It's really at the heart of it. And it's in the way we work as well. You can see it in every element, from our World Cancer Congress, which was hosted here in Kuala Lumpur in 2018, to some of the work we're doing with WHO. We work with the Global Breast Cancer Initiative of WHO. We're part of the technical working group there, and we have that role in liaising between the global community and our members who are working all around the world. Another example I'd like to highlight is the Atom Coalitions. That's a coalition of 40+ partners that we started 3+ years ago now. And it's really working to increase access to oncology medicines, which we know is a big issue, and it's an area of great inequity. And so we're working across those partners, which include private sector, those manufacturers who produce these medicines. And it's really around establishing pool procurement, public health licensing, digital platforms, and really leveraging all of the expertise of those partners to work together to address cancer control. So I think that's probably what the theme means to me.
So I think you're in a good position to be able to say, okay, you're kind of covering the global view, global perspective. You see different groups working together. So what unites those groups when they come together?
The one word that really comes to mind is people. We're all people. We're all individuals. We have a shared humanity, but what unites us is a common purpose. And I think that's the other thing about the United by Unique World Cancer Day campaign. It's around bringing together all those individual stories of people who have some sort of lived experience of cancer, and that can be as a parent, as someone who's experiencing cancer themselves. It could be teachers. There's a whole kind of variety of people who are affected by cancer in one way or another, and that it's really about those individuals. It's about all of that kind of people-centered approach that Sean talked about earlier, and we really come together with that common ambition. At UICC, we believe that, no one should die of a preventable cancer, and anyone who's experiencing cancer should have access to treatment and care. So I think that's really, really what unites us.
So it can't be all that good, yeah? So what do you think still divides us?
Great question. I think, on one level, there's still the massive inequities that exist. We've talked about, access to care, whether that's based on the income level of the country, the geography, or the populations within that. Whether it's about representation in policies, in different groups, whether it's research, patient organizations, whether it's imbalances in resources or in communication and cultural barriers. I think that's one type of aspect which there are those differences. But I think also I really want to touch upon the point that Sean raised earlier and put together so eloquently about the need for integration, and really to put the person at the center, to have people-centered approaches and not be looking at it from a disease focus. It's so important, and I think civil society is such a champion of those approaches, really, where you're interacting with families and communities and people, and we've seen that in the work we do at UICC. And I think it's interesting. We were both recently at the Global Cervical Cancer Elimination Forum in Indonesia, and it's a really important event brought together by primarily infectious disease groups, organizations that have traditionally worked in TB, HIV, malaria, And they are engaging in the cervical cancer space, which is excellent. You see this broader integration of cancer groups within the infectious disease communities. But I think there's so much more we can do. But I think the call is really for us to collaborate and to put time into that collaboration, to listen to the different groups, to bring people together. Collaboration is so important, integration is so important, but it takes time. It takes so much time and effort. We heard from one ministry representative from Kenya who was describing how they've set up their cancer technical working group at the Ministry of Health, and they were saying how they've got people from the HIV groups, from family planning. They've got everyone around the table, and it's such a fantastic example of integration in terms of policy and implementation. But they were saying how much time it takes to include someone from the expanded program of immunization as part of that technical working group. It takes time, and you know, the expanded program of immunization department also has many other vaccines that they're dealing with. Cancer related vaccines is just one element. So I think that's really the challenge that we have. It does take time, but it's critical.
Yeah. No, just to reassure the people that it's not all that bad. Yeah. Yeah. No. That's no. It's good to know that there are challenges, but there are challenges that we can deal with. Carmen, maybe just let's think a little bit about the regional perspective. You've been somebody who's long advocated for Southeast Asian experiences and voices to be brought forward in global health. What regional lessons can you think of that needs to be given greater attention at the global level?
Now, the reason why I've been opening up my phone, people who know me know that I usually just talk from the heart, no notes, but there's so much to share in terms of what different countries have done. So for the first time, I've listed up things. So one of the things that we have noticed over the years is really the intensification of collaboration and learning exchange among different stakeholders, including government. And as well, the use of very innovative, diverse modalities. As a shout out for some, for Southeast Asia region, for example, they have set up a network of hospitals and onco practitioners, and they meet regularly to share both their challenges as well as what are the new updates. And then in the context of breast cancer, you have the Southeast Asia Breast Cancer Network. Again, similarly, being able to learn from each other in terms of good practice models and ways forward. There is also just recently here in Malaysia, 2 weeks ago, the Global Patient Partnership Summit. And the interesting thing here is this was not just the cancer ecosystem represented, but you had NCDs, you had people that were actually living with cardiovascular illnesses and other chronic illnesses. And they were there coming together, discussing the intersections across the different research streams. And then the second one that most often I think other countries still don't know is the maximized use of digital technology and apps. Last year, there was the Indonesian Cancer Society conference similar to this one, and some of the young doctors had actually developed an app, not just for patient tracking, but for information. And this morning, I was listening to the National Cancer Society of Malaysia sharing as well an app that they have developed for childhood cancer patients and their families, integrating everything from transportation to accommodation to psychosocial support and so on. In nutrition, there are 2 organizations in India, Cuddles and Kids Can Kids, that have also developed nutrition counseling digital apps already. And then if we move on to service delivery, patient navigation has been mentioned. We were in a conference last year for the World Cancer Congress, and it seems that in North America and Europe, they think of patient navigation as hospital-based. So when we were sharing that in Asia Pacific, we have lay patient navigators, we have community-based patient navigators, we have peer navigators, they were saying, really? that's possible. You can train volunteer health workers. You can train people living with. And so for me, the realization was that for us, it was a natural thing that we were doing, but for them, it was like a different world and a different perspective. So I think there are things oftentimes that they may be doing that we're not aware of, and vice versa as well. And of course, we always talk of evidence-based advocacy now. But in most of our countries, especially the low-resource countries in Asia Pacific, what we really have is a wealth of stories, compelling narratives. So being able to introduce that we need to capture real-world experiences, and that's what brings the heart. That's what resonates, not just data and figures, which most often we either don't have the resources to undertake service, or even the government is limited in terms of that. But we have found that real-world experiences and these compelling narratives in our country, which says it touches not the heart, but it goes all the way to your liver. And that's what advocacy for us is all about. And then as well, financing, of course, which remains a major challenge. Again, I was in a session here and I was very inspired. Because essentially, I think what we're doing, which is not being done as much, maybe because they don't have as much problem in terms of resource limitations, is being creative in terms of unlocking new pathways, being able to look at new potential ways of being able to either reshape the market in terms of pricing affordability, or being able to reshape who can be the source. Because the reality is our governments, especially those in low middle income countries, they don't have unlimited resources. They're competing priorities. And like you said, people with cancer, we call them walking NCDs. And so therefore, they need to be able to also allocate funds. So it really is a shared accountability. So I'm very proud that in our region, despite the fact that we still have gaps in terms of better access, affordability, and the trilogy of delays, the delay from when a woman or a child or family feels something to the time they go to a primary health care, from the primary health care, the time that they're able to get diagnosed, from the time they're diagnosed to the time they start treatment, because they first have to look for funds, and then finally for them to be able to continue or complete it, we still definitely have that tragedy of delays.
Great. So I think maybe one thing to highlight, since we're talking about the regional, is the fact that ASEAN has got its own post-2015 health development agenda. It's a very interesting and important framework that I think we are many times we are not aware of it or not contributing to it. I think that's something we need to be keeping in mind as we think about the regional aspects of it.
And as well, APEC actually has come up with a series of studies in terms of women's cancers.
Exactly.
And they have supported in-country dialogues as well.
So when we look across this auditorium, and as Dr. Sound has mentioned, we are bringing together quite a wide variety of stakeholders, and there's a lot of civil society actors there. How do you see regional civil society actors influencing policy, helping with resource mobilization, and really driving accountability? Because civil society can play a very critical role in accountability. So just those three areas, influencing policy.
Well, actually, there is a dream and an ambition that we have started to dream about together with certain stakeholders in the region. This is to be able to bring together all these diverse groups and voices and experiences, and to be able to come up with an advocacy ask or platform for the two special bodies in our region, the ASEAN and the APEC as well. Because we feel that, just like, for example, I primarily started off with childhood cancer because of my son being a teen brain cancer survivor who actually organized Cancer Warriors. It's not me, it's him. And so the dream at the time was the only way the childhood cancer would no longer be marginalized and neglected was if it was brought into the regional, in the national, in the global, beyond the national, regional, to the global health and development agenda. And that has happened. But then now, importantly, for us to be able to implement so many of the good plans that we have, for us to be able to bridge and reduce the gaps, I think it's time that we share the accountability with these special bodies of our governments.
Okay, thanks. Before we get to Ariana and the local implementation, I've got a couple more questions just to follow up on at the global level. When you talk about global, you're talking about different cultures, different regional aspects, different socioeconomic groups. How can you bring these people together while, trying to keep united in purpose?
Yeah, it's an excellent question. And I think it's really very much around that valuing those individual contributions or those organizational contributions that come from different cultures. And it's about listening and understanding. And I think it's really interesting when you just take HPV vaccination for an example and the cervical cancer elimination strategy. There are 3 goals: 90% of girls vaccinated 9 to 14, 70% of women screened with a twice lifetime screen, and 90% of women with pre-cancer or cervical cancer treated. It's really interesting when you begin to explore what's happening with the HPV vaccination around the world. That is the kind of global target and the strategy. But when that is taken through to implementation, we can all unite around the importance of HPV vaccination. It is an impressive intervention for preventing cervical cancer. But then when that's taken forward into local context, we can adapt that and look at how that should be implemented. Girls are the primary target of HPV vaccination according to the global strategy. But then when we look at secondary targets at a national level, that may include older girls. It can also include boys. And it's really around looking at how that is then implemented. We have stories from a UICC member in Cameroon where they started off with a mother-to-child intervention. And so essentially the mother and the child would come in, the child would be vaccinated for HPV, or they started off, with a mother-to-daughter intervention. The daughter would come in, be vaccinated for HPV, and the mum would receive breast or cervical cancer screening. And basically, over time, they found that actually this was causing a lot of stigma in the community, and so they decided that this would become a mother-to-child initiative, and they've had great success with that. So that is just an example of how you have the global strategy, the evidence-based recommendations, which should form a kind of a principle, and then how that can actually be implemented. And it's really important to look at how that's implemented at the kind of local and national level. I think it also speaks to kind of, how the messages are communicated. Communication, social and behavior change communication for HPV vaccination is absolutely fundamental to ensuring uptake of the vaccine. And there was a panel yesterday in which UICC's president-elect spoke around misinformation and disinformation. And they also had on the panel a representative of the Catholic Church, and both of them really highlighted the importance in the context of Africa to really work with religious leaders, that actually there is HPV vaccination is very much in line with their faiths. And actually, if they engage religious leaders in that context, it brings a greater trust with the communities. So that's really some way that you can think about how you adapt these kind of broader strategies to the local context. And I guess one final example is we have a program of work which supports civil society organizations to gain skills and knowledge in national advocacy, kind of policy advocacy. And in that, one of the first steps is to really encourage these organizations to work together as a coalition. And the work in the Philippines is a great example of this. You can bring together organizations who are focused on different cancer types, who are different kind of segments of the cancer community, and they can come together. And there are many, many, many core kind of asks that we can unite around. A national cancer control plan. We need that for all cancers. palliative care. It's so important. It's not one cancer or another. You know, there's these asks. You know, health financing is another. There's so many that we can unite around, even when we're representing different parts of the community, or even when we have a specific cultural dynamic or perspective to take into account. It's just a few examples.
And did you want to add?
Yeah, I just wanted to add just a little bit, having been a long-time UICC member.
Yeah.
I think one of the moments when we also come together is when there are strategic resolutions for WHO. For example, the strategic resolution in integrated cancer control. Most of us were actually involved in terms of being able to shape the words or put in more explicit statements. And now for the UN high-level meeting as well, the same thing, that UICC is taking the lead in terms of sharing this with us. And so on the regional level, I think the very important thing, in Asia, we're known to be like the digital capital in terms of phones, TikToks, and all other social media. So I think that's one area.
Philippines?
The Philippines has the most users, supposedly.
No, I don't think I would challenge you. So I think we often hear organizations like UICC, NCD Alliance, WHO, these are all folks coming together, having a talk shop, nothing happens, yeah? But in reality, WHO has got 194 member states coming in, yeah? And then they come together and they try to resolve issues. So they are pushing things forward, and everybody comes as a viewpoint. UICC, the same thing as well, yeah? I think it's a good time now to move to our most important aspect, which is it's very nice talking about global, it's very nice talking about regional, but ultimately, things happen at the ground level, yeah? For those of us who are sitting around there, it doesn't matter what Kristie is doing in Geneva or Carmen is doing in Philippines. They want to know what's happening here in KL, in Malaysia, or in Sabah, Sarawak, yeah? So, Ariana, from your experience in our public health system, what do you see as the biggest challenge, and what are opportunities for improving cancer outcomes at local level?
Yeah, thank you, Prof, for the question. And indeed, yeah, you're correct. We have been listening from Kristie and Carmen in terms of the implementations and the working together in the global area and then at regional area, and what is going to happen in the implementation work. And the first, when I came into this non-communicable disease control, when I start to look into what are the main issues in cancer program in our country, Malaysia, the very most important challenge that we face is the resources. So definitely, resources is number one in terms of monetary, in terms of human resource, in terms of course, the scientific evidence that we need. Is all we need resources. So that's number one. And number two, what I found when we start to revise again a lot of program, especially in the cancer control program, we are all working in silo. In terms of in the medical field itself, because I'm from the public health area, public health doing their own things, medical team is actually doing their treatment, and then the tertiary prevention, even the palliative care is all separated. So I guess when we started to use the theme of World Cancer Day in terms of united by unique, then we started to, okay, let's work together. Because the resources, we can see that everyone is doing the same thing, focusing at the same target group. So this is what is happening in the ground, and I guess not only in Malaysia but also in other countries as well. So that's the first thing that we focus in terms of the cancer control. But the other challenge that we face in this cancer control program, when we start to plan, we should be looking into the wide spectrum from primary prevention, secondary prevention, tertiary, and even into looking into care of the palliative as well. We can't be looking into only prevention or only screening and so on and so forth. And I agree with Carmen. We also have a challenges in terms of navigate the patients, starting from how we try to prevent them, how we try to screen them, and how we try to do early diagnosis and so on. And these all challenges that we are facing, we have tried to put it into a very good structure in terms of putting up into one technical working group. So now we have a technical working group looking into various types of cancer. We invited everyone, not only the healthcare professionals, but also to the civil societies as well. And again, I'm also looking forward to and expand this to the ASEAN as well. And since we are the chair of the Senior Officials Development Program for this year and next year, Malaysia will be looking forward to work together as well, at regional level as well. Yeah, Prof.
Yeah, and importantly, how are you translating it at ground level for the underserved, rural populations? How are you bridging those gaps there?
Yeah, so those gaps for the, for the rural area, especially from Sabah and Sarawak, the one that have very limited resources away from hospitals, we are trying to do a lot of decentralized programs. So one of the program, breast cancer program, we're working together with Roche. We also do on the decentralized program, we try to bring whatever treatment or whatever screening program to the community. That's number one that we do. And the second important thing is we are going more towards public-private partnership. Public-private partnership, getting more resources. And at the moment, we are so good and friend with UICC. We also have a lot of resources shared from UICC as well, and definitely our close partners here, National Cancer Society, Prof. So this is how we try to bridging the gap. The resources that we don't have, we try to look into the resources that we have. Yeah.
So I think it's a good thing to start with the resources, because currently, for those of us who are in Malaysia, and I think generally in any country, we're trying to straddle, we're trying to balance these two arms of one on health financing and the other one on service delivery. And often one or the other gives, yeah? So how in Malaysia could we, I mean, you've alluded to it a little bit in terms of, more innovative ways of getting resources, etc. But how could we do that in Malaysia? How could we ensure that we have equitable, yeah?
I think how should we make sure that everyone is getting all the access? The very important thing is to make sure that the target group of people is correct. That's number one. And then again, we have to remapping the issues. Where is the area that we really have to look into to focus? For example, we have some rural areas that we need to focus. How do we, mobilize the team that we have right now? For example, if there is no NGOs or civil societies, we can move the private sector, we can move other resources on in terms of this equitable. We are trying to do this, Prof. Elil and my colleagues here. We are going to start, actually we have started on the lung health initiative. So this is one of the good module that we hope that by having this unite everyone together, starting with the screening of the lung cancer, and then by mobilizing some resources at an area that we can't reach by moving out together with the NGOs. So we hope that the equitable treatment or screening or everything that should be given to the area of the rural or underserved people, we can manage to have a holistic approach there. So lung health initiative will be the best model. We will try to see next year, maybe we can present some of the outcome. I'm very positive in this lung health initiative, and also I have actually informed Prof. Elil that I'm moving towards the other cancer as well, not only lung cancer. Yeah.
No, excellent, excellent. Thank you very much. I don't know how fast we have to finish, but we've got a couple more. Just a very quick question to the group. One question, very quick answer. How do you think, what kind of role can patients and survivors play in making sure that we as policymakers, we as implementers, move ahead with that? Yeah, very quickly, because there's a guy there is sticking up and telling me time's up. I thought this was very exciting. Yeah, please go ahead.
I think it's down to each group, each one of us, to really build that into our thinking. We have a program of work at UICC around that, really in line with the meaningful engagement framework that Dr. Sawn talked about earlier. It is an absolutely pivotal part of the right to health to ensure that those with lived experience are part of the conversation. It is absolutely fundamental, but I think it really requires each of us to consider that, to support those who, with lived experience, to have the opportunities to raise their voices, to support them to build the confidence where they're not necessarily as confident in doing that, and to really work with them to enable them to do that, because it's really valuable expertise.
Thanks, Kristie.
Yeah.
Carmen?
Yeah, maybe I can
sorry,
start
yeah.
first for the patients group. I guess they are very important for us to understand their needs, and for us to put them together in terms of to support each other in terms of the way of how they go through on the treatment and so on. Yeah.
Yeah. Carmen, please, thank you.
I just want to expand that in the context of our region, no matter how old you are, the family plays an important role. So I would say the voices of the patients, the families, even those who have lost their loved ones, most often, they're more active in advocacy because they want to honor the memory of their loved one. Okay. In the Philippines, we use the imagery where you are cooking what we call the bibingka, which is a glutinous rice cake. Essentially, there's fire at the bottom. Okay. Those are the voices of patients and their families in the community. And then there's pressure on top, that's the media. And then you get the policymakers and decision makers. So for us, it's multidimensional and multi-layered, but definitely the voices of medical practitioners are very important. When we come together, as well as the private groups and the researchers, we are awesome.
Okay. No, thank you very much, the three of you. It's been very, very helpful. I think, you heard the global perspective, you heard the regional perspective, you also heard what's happening at ground level, at national level, what needs to be done. I think one theme that came across is it's about people, yeah? And I think we need to keep that in mind and continue our efforts. And thank you all for being very kind to listen to us. And hopefully it was helpful for you as well. Thanks a lot. Yeah.